Hello, everyone. Welcome to the Common Good Data Podcast. My name is Drew Reynolds. Folks, today we're going to talk about the challenge of economic mobility. Economic mobility is an enduring challenge. I think it's coming up more and more in the social sector, so I wanted to have an episode that really focuses on this topic. Now, economic mobility refers to this idea that it is possible for someone born perhaps in a more low-income situation to transition and to increase their economic outcomes and futures in the future. And it's very much tied to this notion of the American dream, the idea that you can have better economic fortunes than perhaps your parents did. And part of this was all about what it meant to be an American, right? To be able to come to America, live out your economic dreams, and be able to succeed and have economic prosperity. The challenge, of course, is that notion of the American dream has been getting a lot of challenge recently in the public. According to some Pew Research, for example, only 64% of Americans believe that there are opportunities for upward mobility and that they're widely available to Americans, which is the lowest level in decades of tracking by Pew Research. That same set of research also found that roughly half of a parent's income advantage or disadvantage is passed on to their children, which suggests that maybe we aren't so highly mobile in the United States as perhaps maybe the American dream narrative would like to otherwise communicate. And so we have this challenge, right, with the idea and notion and values of economic mobility and the American dream in the United States, with the reality that many of the lived experiences of families and individuals in this country are kind of challenged being able to live that out in their lives. Now, this is, of course, very relevant to folks in this audience because many of you either are working on issues of economic mobility or recognize that economic mobility is so intricately tied to things like mental health, substance use, stress, physical health outcomes, access to services, engagement in the social service system, broadly speaking, and, of course, program effectiveness. And so the idea of economic mobility, I think, is so central to what we do that I think this is going to be broadly resonant with many of you who are regular listeners to the Common Good Data podcast. Now, there's an idea out there around how to address economic mobility called guaranteed income. You might hear different versions of this: guaranteed income, guaranteed basic income, unconditional or conditional cash transfers are sometimes used. But broadly speaking, what do all these terms refer to? They refer to the idea that there may be, as a part of a social service system or some type of setup, you can provide direct cash transfers to individuals who are living in poverty. And the idea is that they are able to receive those cash transfers and that additional funds that they're receiving, perhaps on a monthly basis over a given period of time, that it's going to provide some additional economic stability that leads to better opportunities, decision-making, chances to try new things, start a new business, find a new home, make those sort of changes in a person's life that would lead towards more economic mobility that will ultimately lead to better individual and household outcomes, right? So the idea is that by providing these stable set of funds, it allows people to achieve those economic dreams that they have for themselves and for their families. Now, the evidence on a guaranteed income, it's been well researched over a long period of time. There's still a lot of research that needs to be done on this, but there's a fair number of pilot studies that have been done across the United States. Actually, a lot more done internationally even, but there's still plenty here in the U.S. as well. And this growing number of evidence is emerging to support that there is some connection between a guaranteed basic income and employment outcomes, health, financial stability, and others, though that evidence continues to emerge. And so to have a conversation about guaranteed basic income as a program and also some of the approaches to evaluating the effectiveness of a guaranteed income pilot, we've invited Dr. Michelle Carrera-Morales of Xiente, which is an organization based in Philadelphia that is focused on economic mobility for the community that they serve. And the idea that we're going to talk about here is what this guaranteed basic income is and also how they're approaching gathering the evidence base needed to be able to examine whether that is having the effect that they hope it does on the community and how in turn that information can be used to inform policymakers and others to be able to think critically about how a guaranteed income approach might be a useful idea to integrate into our existing social service net. So very excited for this conversation, and I'll turn it right on over to the interview. Dr. Carrera, so glad to have you on the show. Welcome today.
Thank you, Drew, for the invitation. I'm happy to be here.
All right, wonderful. Well, I'd love for you to talk a little bit about the work that you're doing in your organization and kind of this question around economic mobility. So, how do you define economic mobility, and what are the structural barriers in the communities that you serve that make it particularly challenging for folks to be upwardly mobile?
So at Siente, we work with economic mobility from a two-generation approach. We work with families, with children, especially that are facing some type of economic distress or are facing poverty as defined by the guidelines in the United States. Usually families that are below that 60% poverty threshold in terms of Philadelphia. So these are families that usually can be earning, if you're an individual, you can be earning less than $30,000 a year. Families that may not have any employment, that are facing barriers to employment. I think for our families, we have several barriers that affect their economic mobility and their situation. One is housing, one is employment and career opportunities. And others are more supportive services like having access to adequate childcare in order to pursue opportunities, having access to capital in order to begin entrepreneurship ventures. So at Siente, we work with families in helping them create that path from poverty to middle class. So we call it that path to prosperity.
Wonderful. And I was really interested when I was learning more about Ciente, and you talk about in your theory of change, kind of the need for both individual supports that families and parents and individuals will need, as well as the need for systemic change. So I'm talking a little bit maybe about how you're trying to integrate both the individual and the systemic change in the work that you're doing.
So when we began this process 3 years ago and adjusted our strategy, we knew that we could not program our way out of poverty. So
Mhm.
whatever data we identified very early on that we needed to collect data in order to eventually affect public policy. That's the ultimate goal. How we eventually are able to make sure that we can affect a public policy. Why? Because, for example, you may have a family that when they reach $40,000 in income and they begin to face that benefit cliff, they become so afraid of that jump. We call it the jump from 40 to 60.
Yeah.
And that's a policy barrier, right? Like that is very hard to overcome with programming unless you do things like a basic guarantee income, and that's why we got interested on it. But that benefit cliff need to be addressed through policy. So that's why we thought it was important that we collect data and that we collect information that eventually help policymakers make better decisions that will leave more people out of poverty.
Yeah, absolutely. And I think that you bring up a great point. A lot of times people, especially in the nonprofit sector, are sometimes afraid to engage in the conversation. Maybe there's a reticence, maybe they don't feel prepared to, or they think as a nonprofit they're not allowed to. Or sometimes they'll feel as though they might alienate members of their community if they sort of engage in policy conversations around issues of their areas of concern. I'd love for you to talk a little bit about how you've been thinking about that at Ciente. Like how do you kind of think through the policy challenge, and how do you maybe educate your stakeholders in your community about what you're doing and why you're doing it?
I think we try to tie up policy to the benefit cliff. Sometimes when we think about poverty, we have very myths and misconceptions. And in our country, we have a lot of hardworking people that can afford a rent or can afford a rent plus a house plus the insurance of the car plus everything else. So I think that approaching a stakeholder from a reality check perspective of understanding that number one, we have a lot more people that are just the working poor, right? That they still work, but they feel that they cannot make it, that they don't have enough for savings and those kind of things. I think that helps. Sometimes we assume that everyone understand what is the reality of people facing these challenges, and the reality is that not everyone went through the same experience. So I think that addressing education is important in order to then open the question and say, can we think about our social safety net and how we manage that? And how is our social safety net doing what it needs to be done? Doing of encouraging or like helping people actually overcome financial distress, or do we have a safety net that is like, I will give you enough so you don't get in deep trouble, but I don't comprehend everything enough at the same time to be able to build a bridge for you from poverty to middle class. I think that we do a very good job of stabilizing people. We have SNAP, we have some housing opportunities, we have a workforce development programs. I still need to figure out as a nation is that bridge. So I think that when I talk to policymakers, I focus on that, right? We need to recognize what we do already well, we stabilize well, but then is how we build the bridge into middle class that is what we need to activate the economy better and to provide better opportunities for future generations.
So you have one way of addressing this kind of gap between 40 and 60,000 and others. One strategy organization Ciente does is this guaranteed income
Correct.
approach. And I'm wondering, for those who are listening to our podcast and who might not be familiar with guaranteed income, can you talk about what the guaranteed income program is, and then kind of broadly speaking, and then like what does it look like in how you implement it at Ciente?
Yeah, so basic guarantee incomes are programs where the families receive an unconditional cash transfer of a specific amount for a specific duration period. In our case, we pilot a program that is an 18-month program, $500 a month, unconditional cash. In our case, the way that we implemented the family beyond the cash is also part of our prosperity project, so they get an economic mobility concierge that is helping them navigate through whatever challenges they may have at a moment that prevent them for reaching their goals. So when the family come in, we do an economic mobility assessment. We assess where they are in terms of social network connections, where they are in terms of education and workforce, and where they are in term of of capital and management of capital and savings. And from there, we create a plan, and the role is to make sure that we move that families from point A to point B, and the basic guarantee income is on top of that. So ours is a little unique that the families are receiving that support, but they're within an economic mobility program.
Yeah. Yeah, and I think that's interesting how you guys were able to kind of pair that additional financial support with the economic mobility counselor and some of the other programming supports to kind of help people
Mhm,
kind of figure out what they're looking
mhm,
for and what they may need. So you know that this is a one thing we focus on a lot in this podcast is data and evaluation work, and I
yeah.
actually am very fascinated in the research on guaranteed income programs because there's a lots of different ways that you can implement them. There's lots of different research
Mhm,
studies and pieces out there. So I'm curious about, I know that you're kind of still in the midst of the program, but as you're thinking about data collection and evaluation,
mhm.
how have you been thinking about what are the sort of outcomes that you're looking for some of the families, the 500 who are going through this pilot program, and how are you thinking about measuring that?
Yeah. So in terms of the basic guarantee, we have a smaller subset of families within that 500. We partner with the University of Pennsylvania, and they're doing the research piece. So
Hmm.
they're using a concept that is called the financial diaries. So every month they have a data collection point with the families to see how these $500 are making a difference in their life. And they also use a questionnaire. The focus on that type of evaluation is two pronged. Like the University of Pennsylvania is focusing more on the psychological effect of having that 500, right? The piece that it
Hmm.
may give you on and the use of the funding. I think that for us, the other data that we're collecting and the other instrument that we're using, the economic mobility family assessment, we're looking more about we're looking more at the data that will let us know what really helped in moving one person out of poverty beyond program, right? We're
Hmm.
looking to learn if having that concierge or that economic mobility counselor working with you without judgment in helping you navigate some of the challenges that you face will be effective at the end. And we do that through survey. So we hope to at the end get enough data that help us kind of like improve the safety net, that we say, look, it may be better for to give people money unrestricted and let them use their sense of agency to decide how to better use it, than for us to try to run a social safety net that require a ton of bureaucracy step for people to get help.
Yeah, I think it's interesting kind of how you're seeing that interface with, but also sort of be a supplement to, or a little separate from existing
Yeah,
safety net material supports out there.
yeah,
And
yeah,
you have that kind of
yeah.
two things going together at the same time, right?
Yes, yes.
Do you have a sense of kind of when people talk about kind of economic mobility programs, you mentioned that the Penn researchers are focused on the psychological aspects of what does it mean to have the additional security of $500 a month to be able to meet, essential needs or
Hmm.
resources in the family. Some people in economic mobility, I guess kind of the big question is with these kind of cash transfer or guaranteed income programs is kind of what does it do for the person beyond the funds that are received, right? So they'll receive funds, $500 a month to be able to pay expenses and manage that burden. But it's oftentimes insane. Like, what does that psychological change look like? Or does that lead to
Hmm.
some type of
Yeah,
transition into more secure housing or a more secure
yeah.
job or that kind of thing? So, what do you think? Are you hoping for the families who go through this program? What are you kind of hoping are some of those outcomes that will be most useful in helping to tell that story of transitioning into the middle class?
So in our case, in our proof of concept, we the families, some of the families get the 500, get the economic mobility concern, and get an affordable house that we manage that is not subject for an income cap. So what we have seen so far and what we have hoped to prove is that we can accelerate the movement of a family from a poverty level to a stable middle class and self-sufficiency. And what we see so far is that we have families that began with zero saving and now have $6,000 in saving and are already beginning to talk and work with their counselors about home purchasing.
Mhm.
We're seeing families that are more willing and able to start a business
Mhm.
because now my housing is not dependent of me like thinking, oh my god, if I make X amount or more I'm going to lose my apartment, and I have this $500 also as a cushion. So is that piece, we call it, it sound cursive, but it's that piece of sometimes when you're living in poverty and you're in survival mode all the time, you need to get to that peace of mind in order to dream and to design a different reality for yourself. So we're
Yeah.
seeing some of that already, but the biggest hope is, can we prove that people will move quicker if we lose a little bit some of the restrictions on the process and we give them some leeway in terms of cash. So
Yeah.
that's what we hope that we can prove at the end of 5 years.
Yeah. Well, I think that, the part that you mentioned around that sort of sense of peace or security, that one thing that allows you to make that next big step, whether it's a home
Hmm.
purchase, starting a business, starting a new
Hmm.
job, kind of some of
Hmm.
those things that you having to have those kind of core bases in place so you can make
Hmm.
that next,
Hmm.
that's so important.
Hmm.
Well, this is amazing. Tell us more. I know that you're kind of in the middle of a study and whatnot. So when do you kind of hope to have some results and things together to share?
Yeah, so for the first stage, we hope that by this fall we will have Penn will have the first draft of the outcome, and by next spring, and you're an academic, so you know that research when it's done through IRB take a long
Oh, it
time.
takes time. Yep.
So, but we're excited to get some preliminary results. They will do the final surveys this summer, and we hope to have some preliminary results in the fall and the full report by the spring. So we're excited about that.
Yeah, very cool. Well, I'm excited to see what it is, and we'll have some
Yeah,
links on our page and whatnot to Ciente and the work, Dr. Carter, that you're doing in the group. So, very exciting conversation. So
thank
now
you.
you do this work on guaranteed basic income, but I do want to give it a chance to talk a little bit, kind of too, about some of the other programs and approaches that your organization offers. And so, what are some of the other things that you're working on, and how are those also kind of connected to this broader concept of economic mobility?
Yeah, so for us, everything that we do is in order to support our families to thrive. So we provide preschool services.
Mhm.
So we do dual immersion preschool for kids 4 months old to 4 years old. We run a teen center, and in that teen center we have intense prevention services for young people who have faced violence or some type of truancy behavior, and we do workforce development with them because we know it's important for youth that are living in communities of high need to be exposed to work early on as a protective factor. And we also provide affordable housing. We have around 75 units right now of affordable housing,
Oh,
and we're
amazing.
looking to expand that inventory, and we're looking forward to continue to grow that. And we have in order to maximize that, we have housing counselors on staff that help families navigate the process of home ownership, and provide also eviction prevention services for our rental clients.
Wonderful. Well, I mean, there's a lot of different things you can do there, and I think the housing
Yeah.
piece, the education piece, and the youth piece kind of coming together, and certainly
Yes.
along the guaranteed income, it really kind of speaks to the importance of meeting families holistically and recognizing that
Yeah.
there's different types of needs around childcare, housing,
Yes. Yeah.
transportation and funds and others. So
Yes.
amazing, amazing work. For
Thank you.
folks who are inspired by this conversation and they want to learn more about Ciente, how can they do that? Where do they find you?
Yeah, you can go to www.siente.org, and click contact us, and we'll be happy to chat with you.
Wonderful. Well, Dr. Carrera, thank you so much for your time today.
Thank you. Have a great day.
You too.